Hi, everybody. Oh, hi, everybody.
Hi, Christa. Hi, everyone. Welcome to today's live. Christa, it's so great to have you join us again today.
Thanks for having me here. And just would like to tell everybody we have a little bit of a different background. I'm not in Eastern Canada. I am in Eastern US in Florida, just visiting some colleagues and some friends. So it's about 40 degrees warmer, no, maybe 30 degrees warmer than back home. So I'm pretty happy to be here.
Wonderful. What a brilliant change. I love it. I also am in a different spot because the lawnmower is running right outside my office and, I can't even hear myself think.
Well, at least there's no thunderstorms this time.
No thunderstorms this time. The sky is blue and clear and beautiful. So let's see how it goes. Last week's live ended with a massive thunderstorm. I went from daylight to nighttime darkness in the middle of the afternoon in the space of about 10 minutes. It was very interesting. So if you guys are joining us live, it's so great to have you. We're doing something different today. StreamYard's brought in a feature where our guest can share to some of her own destinations. So we're testing it out. If you're watching us on Facebook or Instagram or LinkedIn or YouTube or wherever we're streaming, because we're going to a few places at the moment, let us know where you're watching from, where you're joining us from. Post it in the comments. Who are you? Where are you at? And where are you watching us, so that we know if these multiple streams are working. I think it's quite a great way for us to reach different people in different places, because we're not all on Facebook. So I love that. And we are going to be chatting today about lymphedema and the lymphatic system and the awareness that we can help bring to our clients in this time, in this month. It's Lymphedema Awareness Month. So Christa, would you please introduce yourself? Let us know who you are. I think a lot of us already know you, but there might be some newbies here, and your interest in lymphatics.
Well, again, I'd like to say thanks for the invitation. I have been truly obsessed with the lymphatic system for almost 25 years. I started my training, I think back in 2001, my official lymphatic drainage therapy training anyway. And my background historically is that I'm a massage therapist, and I'm registered in 3 Canadian provinces. The program I took was 2,200 hours, and then I became specialized in advanced lymphatics and also with then I also became the first practitioner to take equine kinesiology taping, and from there that has just expanded my entire practice. I've been treating since '99. Some of the therapists I meet, they're like, "Oh, I wasn't even born then," but it's been a great career. The first 10 years was probably all about education, and that's something that I continue to love to do. I love to teach, and I'm developing some courses and stuff like that. But the lymphatics and the study of them truly is invaluable. I think that the research needs to be more in depth, more specific about how we can help, horses with this condition. I'm so obsessed with the lymphatic system that I actually incorporated it into my logo. You'll see, if you guys stalk me on socials or whatever, you'll see that I have the horse head, and I had my designer actually incorporate lymph nodes and lymphatic vessels in that logo because it's so important to me, and I just love the results. So the background from that is, I truly believe, and I say this all the time, that it is the therapy of the future, that it needs to be studied more. We need to have more practitioners using this type of therapy to help clients with.
All right. I love that. Thank you, Christa. To those that have joined us live in the meantime, it's so great to have you. I see a lot more eyes on us, which is amazing. Let us know where you're watching from, which platform you're on, whose page you're on. It'll be great to know where you guys are. And then, Christa, I love that you've mentioned that you teach and you're an educator. You actually shared a webinar with our online pet health members this month on the lymphatic system. And I think that's a really great place to start, because you kind of condensed it for me into some really practical take-home points. So what would you say is like the number one thing that you want people to take away from that webinar?
When you've been practicing as long and I think I stopped counting at like 60,000 treatments. It's very hard to compress your entire career, and the therapists that, have been out there a long time understand this. They've accumulated so much knowledge, and then we ask them, oh, can you spill it out in an hour? And so you have to kind of pick the most important pieces without really getting complicated. And so one of the things that I can tell, whether it's a therapist or a horse owner, is to make sure that you don't granted. Have a really great connection with your other members in the team, like whether it's your veterinarian, whether it's your massage therapist, chiropractor. All of these will help you assess and diagnose a problem that may be something very simple, but if you take it for granted and maybe just do a little cold hosing, then it turns into something very, very severe, and now you're dealing with a year-long lymphedema problem, or it develops into cellulitis. So I think being more proactive with any sort of swelling is probably my biggest takeaway from that.
Okay, I love that. Welcome to everyone. Melissa Hansen from Minnesota, Becky Denny watching us from Canada, Western Canada, on the Online Pet Health page. It's so great to have you. Writer's Rain, Hannah Merchant from the UK, amazing. Nikki Harrycourt, who's an Equine Lib student. Welcome. It's so great to have you guys. I love that we have students with us today, because tomorrow is your day, and this is something that's going to really help you open your mind and think a little bit differently about things. And it's my favorite part of what I do, is being able to chat to different professionals and get some different perspectives. So let's focus on, let's chat a little bit about what are, we know about lymphangitis and the big things that go wrong, but smaller things go wrong before we get to that point. So can you tell us about some of the different kinds of drainage issues that we might commonly see in horses, and that we might miss in treating them effectively as a lymphatic problem?
So, oftentimes it can start with a very, very small pocket of swelling, and you bring them in from turnout or from the pasture, and you're like, oh, he's got a little bump here and there, or maybe he got a little kick, and he's not really lame, I'll check it tomorrow. And when in actual fact that you should really run your hands over it, see if there's any tiny, a lot of times what happens is that there's a little cut and something will get into that broken skin. And then you wake up in the morning and you're like, oh my gosh, this is blowing up into a really big problem. But one of the other things that happens is that if you see, say, for example, a reaction after a vaccine, that you have the vaccine, and this has happened so many times, where the horse has a reaction to a vaccine, and maybe one or two joints are swollen, or maybe there's a little bit of swelling in the neck. And then what happens is that subsides just a little, it never really goes away. And then there's something else that comes along, whether they have another reaction to something, or maybe they have an illness where the lymphatic system is working harder and harder. And so it's often, for systemic edema, a combination and a buildup of events. Systemic edema doesn't necessarily happen like boom overnight. All of a sudden you've got these huge lymphatic issues. It's when you go back and do a really good case history, you can track to, he had his vaccine, didn't really do all that well. And then, we had a virus go through the burn, and now his, cervical lymph nodes are all swollen, and now he's not performing. Another thing is that if they have any sort of like pneumonias or lung involvement pathologies, that sometimes they'll be on antibiotics for that, but they don't really get completely cleared up, and then it just ends up backing up into a bigger systemic problem.
Okay, I really like that, because the systemic edema is something that we might not recognize immediately. And I had that with one of my own horses recently. After watching your webinar, even, I still didn't see it. And it took a colleague coming to visit me, looking at my horse, to say, dude, she's puffy under her cheek, she's puffy around her legs, she's just puffy everywhere. There's edema all throughout her body. And we worked on that and saw an improvement within a day and an improvement within a week after that. And it was great, but I missed it because it's not something that, that I'm looking at all the time. And of course, she's very overweight as well, which doesn't make it easier.
Oh, I lost you there for a second. Can you just go back and repeat that? I think we're having technical difficulties. I can't hear you at all.
Something else you want to add in terms of?
Oh, there you are.
Can you hear me? I think.
Yes, I can hear you now.
I think I'm going to have to move because obviously the connection is not working here. While I move myself, Christa, would you like to chat a little bit more about maybe your favorite techniques to use to help support the lymphatic system? And if there are any questions from our listeners, please share them and we are going to answer them. And I'm going to be listening. I'm just going to move to where I hopefully have a better connection.
Okay. I was worried about that. Okay, so you guys get me solo. So I can tell you that opening up and even just doing very light massages around the biggest aggregate of lymph nodes helps a lot. You don't necessarily have to be, a trained lymphatic practitioner to really get lymphatic fluid moving. First and foremost, no matter if it's a hind leg or a front leg, can be abdominal edema, no matter what, you always have to open up those primary lymph nodes first. And so you can do some light techniques around like the base of the neck and around like the inguinal area. And what that does, and I always go back and I use this analogy, is that it definitely opens up the pathways to give this systemic edema or even regional edema, local edema somewhere to evacuate into. If you don't open up those main lymphatic vessels and channels first, it's almost like trying to squeeze toothpaste through a tube with the cap still on. Working around very gently around those lymphatic nodes, the lower cervicals, inguinals, things like that, is like taking of the toothpaste tube, and then it gives the edema somewhere to drain into. And it's really amazing. Lymphatic vessels can actually regenerate within 14 days of being severed or, having been cut by surgery. So you can do work in the acute stage. Sometimes you necessarily can't work directly on the site, but you can certainly work around above the site. Very rarely would you ever want to work distal or below the affected site, whether it's systemic edema or regional or local edema. Again, because you don't want to push that fluid up and into a compromised area. What you want to do is pull the edema this way. The big misconception, hi Anna, is that the biggest misconception, I think, is that people think you can push fluid out. The way, I think I got off on topic, but anyway.
No, I've been listening and it's been perfect, yeah.
So the way the body works, very simply, is this. So it can send fluid, say for example, down the leg via one pathway, and then it, increases circulation, does a job, and then it sends fluid back up the leg, another pathway. So it comes down one side and then goes up another pathway. And what happens a lot of times is that the ascending pathway gets blocked, restricted, cut. There could be scar tissue, there could be adhesions. Whatever that cause is, the body, bless its heart, still thinks that it can send fluid down that leg, down that leg. It can send it down that leg, but it can't get it out. And there's no signal sent back saying, hey, I'm getting too full. There's no more room for any more sweat or edema. And that's where congestion begins. Mm-hmm. So if you have a garbage can and you're always putting stuff in there, what's going to happen? You're not going to have fresh going in there. It's going to start to rot, and that's what happens with true, like really congested edematous sites, is that there's no fresh circulation getting in, no new nutrients, and it's getting congested, and that's where you run into a really big problem. So as therapists, as a lymphatic practitioner, we tell the body with clearing the pathways above and around the sites is that, you know what, maybe that pathway is locked. Maybe that pathway has been so damaged, you're never going to be able to go up that same pathway. But what you can do is tell the body that that road is closed, but maybe you could open up this pathway and that pathway. And then the body goes, oh, this is perfect. So maybe I can't go take that road anymore. But now I have all these other little roads to evacuate the fluid. And that is how, you can clear an area and it stays maintained. Some serious cases where there's a lot of fibrosis, it is a maintenance program that you have to put them on. You see them once every 3 or 4 months. Maybe you see them before they travel. Maybe you see them so that you can keep those pathways moving freely. But when you run into problems is when the fluid stays stagnant, it doesn't go anywhere. And then the way I always, going back to food, the way I always think of it is when I'm working, lymphatic drainage therapy is very, very gentle. Like you only use a very, very light technique and a light pressure. And when you start working on a horse that is just having a minor problem, you want your hand to feel like it's going through water. And if you guys seen the webinar that I did, you'll know that the majority of the main lymphatic vessels are superficial, right? The majority of the nodes are deep, but the vessels themselves lay just under the skin. And so the way I describe it is that when you do massage, I don't know if I can find my camera here. So when you do a massage, you're actually working on the muscle themselves, right? So this is your muscles, this is your skin, and the lymphatics lay just under there. So that's, truly how light your pressure is to move this massive amount of fluid. There are different techniques that you can do that are more advanced that you go into the deeper layers, but honestly, that's the first start. So you want to use a light technique and you want to make it feel like your hand is going through water. What happens is as the lymphedema progresses or the edema, the general local edema becomes more and more congested and you don't have that flushing of the area, is that it starts to feel like thick gravy, right? And so what you don't, and so you're going, it's very, very slow. The body doesn't kick in that fast. And then when you get into a very serious case, it feels like you're going through jello. Like there's so much resistance against your hand. So that's my food analogies for today. But that's basically what you feel as a therapist.
Okay, I love that. Thank you. Thank you, thank you, thank you. Welcome to everyone who's joining us. Brianna, it's so great to have you here from northern Minnesota. I love it. Okay, so I think for me, the biggest thing, because there are so many things I have done wrong when it comes to lymphatic kind of work. And you mentioned the one, we try and kind of squeeze all the fluid out. And this idea comes from kind of normal practice of wrapping the leg and trying to like wrap that swelling out. And so I've tried, in my cleverness, some techniques where I've tried to push that fluid up and out and have always been unsuccessful. And now I know why, because it's not about getting the fluid out of that spot. It's about clearing the path, and that's a whole different picture. So I really like that. And that's, like you said, you're kind of working with the fascia, you're working with the adhesion between the different layers, right? So that the fluid can flow through there. And then knowing those pathways is important, because you need to start, like you said, at the beginning, which is at the front, right? Which one is that? Under the armpit, the axillary one, or the one in front of the scapula?
I always start in front of the scapula. Yeah, in front of the scapula, okay, for sure. Yeah. Now you can do.
We start there and then you work. Okay, I love it. And light techniques. There's so much power in that. Okay.
So
Yeah, go for it, Christa. Yeah.
So I would like to first talk about, like, I'm going to backtrack on what you said, and it's about pushing that fluid out. Okay. What happens with that technique is that you truly are compressing the vessels, right? You are literally squeezing out. And this is something that I always caution, and you see it 1,000 times with taping, is that people tape too horizontal instead of this way, right? Mm-hmm. So when you're doing the generic lymphatic taping, it's a bunch of long cuts, and you're supposed to angle them in a certain way. What I'm starting to see is that people are doing more of a horizontal strip as opposed to and what you're doing and then what you're doing actually is creating that tourniquet effect. So in short term, it might work. And the same thing with bandaging. It works when they're in the stall. You take them off and the bandage is off and you're like, fantastic. This is great. And then you leave it for 20 minutes. And what happens? That the leg fills back up because you've created this pressurized system to push the fluid out, but you're only moving it in a different segment. You're not evacuating it. Right? So what happens is that you have this compression, and then all of a sudden you take that compression off, the body goes, oh, thank God, and whooshes the edema back down to that area because those vessels are now open. So that's one of the things that I always try to tell people is that the horizontal taping is, or the same thing with a tourniquet massage technique, is not going to be successful long term.
Okay. No, I really love that. And it kind of feeds into the conversations that we have more and more about treating the horse as a whole. You're treating the entire system. You're not just treating one local area. That's not how you're effective in the long run, or how you affect change in your patients. So I think this month is Lymphedema Awareness Month, and we have the webinar that you've presented on the online Pet Health Members Portal. And we've had a chat about lymphedema before last year that we've reshared on the platform, so you guys can go and watch that. So I want to shift our focus a little bit from the actual things that we're doing and that we're seeing to how we can create more awareness about this for our clients and in ourselves. So Christa, what would you say to people? How can they bring a little bit more awareness about lymphedema or lymph conditions or lymph challenges to themselves so that they're more aware of looking for it? And then secondly, how can they bring that to their audience, to their clients, as a way of educating and bringing awareness in this month?
So I think the platform that you guys offer is invaluable. They can watch these webinars at any time from the comfort of their own home. The panel that you guys select are world class. Like, really, anybody wanting to learn needs to, continually always try to take pieces away. Now, maybe it might not be a webinar that you absolutely love everything. It might be just one piece of information that you take away, right? I think reading books still is a huge thing. Like, I have an entire library of books. I've had them forever. And because one of those books, it's from 1965, and, they were giving whiskey to horses for colic, but in one of those pages, it was a one-line statement that stuck with me forever. So I think, researching high quality material is important. And then, reading a lot, and also setting up discussions. And, it's unfortunate because we are all so busy but with other practitioners, with veterinarians, the majority of veterinarians, they only get a very short education in lymphatics. So as therapists, we need to reach out more and let's have the conversation. And so this has been my thing this month. Has all been, let's share your stories, let's talk about your case histories, and I got goosebumps. I think once the conversation becomes into the mainstream, it will become more known. Like you even your son thought your horse was chubby, but because we had that discussion, now and if then you can pass that knowledge on to everybody. I think that's the biggest thing that we can do is just open up these platforms. Don't be embarrassed to share that, you went out and your horse's right front leg was huge. But also, really, truly maintain that professional connection with your healthcare team, whether that's you as a primary practitioner or, you're a horse owner that needs to have a group of people too. But I think talking, sharing, all of those things are invaluable.
I love that, Christa. So what books are you reading, or do you have in your library that are specifically around the lymphatic system so that we can add them to our libraries? Do you have any?
Yeah, but there's not a lot out there. I'm trying to get a book from Germany, actually. Okay. And if I was home, I could show you my library, but I'm not. So there's a book from Germany that's coming out, and there's a couple of other therapists around the globe that I think are trying to get together a big curriculum. There is one that I took because obviously back in 2001, that was, I was privileged enough and lucky enough, I guess, to be trained by Dr. Bruno Chicley, who is the French physician that developed most of the manual lymphatic drainage therapy. And so his book is called Silent Waves. It is completely geared towards people. There's one, and I think I shared that in the webinar. It's not a bad photo. It's just that we've expanded so much more knowledge on that. And, but that was never his forte. The skill set that he had was with and we can always translate that back to an equine, a canine anatomy system, right? So that's a really good one, but that's a heavy one. You really, really have to understand a lot of anatomy and stuff like that. Maybe I'll put that on my to-do list. Thumbs up if you think that's something I need to add on. But yeah, so I think that, even a lot of the medical textbooks, veterinary textbooks that, sometimes can be a little overwhelming. Even you can study from the photos. Not everyone has a 2-year medical background, and that's fine. There's a whole entire new generation of therapists coming, and they want to learn and they don't know where to start. But I'm always go back to textbooks. There's some great online forums and there's other things that you can, Facebook groups. With some of the Facebook groups, you need to be aware that people sometimes can be quite emotional, and you have to kind of sift through that because it is traumatic to see your horse having this sort of issue. So I wouldn't necessarily take that as an educational component, but you can always learn from everything, right?
Yeah. I truly believe that there's something we can learn from everyone in every situation. And I love that you've mentioned that as well. Even if a webinar, if there's just one thing that you take away from it, it's a win. It's been a benefit to your time. So those are great ways that we can continue to challenge ourselves and our knowledge. And I want to take that a step further for you guys, because this is my job, and it's not something that you necessarily think about very often, but take that information and share it. Because the moment that you share something interesting that you've learned with your clients in whatever format works for you, honestly, if you're creating a visual, if you're creating a Facebook post that's very descriptive, if you're creating a reel, whatever works for you is what is important at the end of the day. But when you share that knowledge, a few things happen. Firstly, your clients realize that you're human and there are things you do and don't know, and that's great. Secondly, it builds their confidence in you because they realize that you're learning and that you're growing continuously. And when you don't have the answer, you go find it because you're sharing that with them. So it builds their confidence in you. It makes you more relatable to them. It continues to engage them with you. So it keeps your clients seeing you when you're not there. And that's important to us because, again, it creates that awareness in them, like I just had with my horse, where I didn't even know I had a problem until my colleague pointed it out to me, and then I could address it. So it creates that awareness for them that, hey, maybe I have a problem that I didn't know about. And that's the whole point this month, right? To be creating awareness. So I want to challenge you guys to, if the lymphatic system is not something that you know a lot about, like me, I'm very happy to admit that there's a lot of stuff I don't know. If it's something you don't know a great deal about, go and learn something and then share it so that we can create more awareness around the subject and we can get those conversations going, because that's what's going to happen. We're going to start some conversations and we're going to start to challenge ourselves, and we're going to say, I don't know the answer. Let me go find out what that is. And that's what it's about. That's what it's about. So Sally Harris, is all swelling considered lymphatic buildup, i.e. trauma to a joint? Christa.
Well, I wouldn't necessarily say that it's called a lymphatic, hi Sally, a lymphatic buildup per se, like, because you do have that acute response from the body, say for example, before an injury, settles down to that area that it needs more fluid, whether it's to protect the area, more nutrients, oxygen into that site. So would I consider that a lymphatic buildup? No. If that swelling stayed for a period of time where it either got bigger or didn't change all that much, then I would say that there was a congestion or a buildup in there. But for acute injuries, you can't really I would not classify that necessarily as a buildup. It's a response to an injury, and the body's trying to help heal that area right away.
So how do we respond to that, Christa? Because inflammation is good and swelling is good in that initial phase. How do we want to respond to that and take that forward so that it continues to be a positive thing?
So what you want to do is not necessarily, because the body gets carried away, right? It's like, yes, I can fix that, and I'm going to fix it now. I'm going to fix it as fast as I can, but it doesn't necessarily mean it's the best thing for the body. So you want to almost control the amount of fluid out there.
That was my small human, sorry.
Oh, I miss my small human. My humans are back in Canada, so miss you guys. So what you want to do is use tools like cold. You might not be able to use ice if it's very acute. And what you're going to do is create sort of a vascular effect where the body's sending fluid down into that area to protect it. And then you're going to use cold just so that the body doesn't get carried away. That being said, and this is where you kind of have to, use your own assessment or reach out to your veterinarian, things like that, because sometimes you don't want that fluid to come out right away. If it isn't a joint and say, for example, the ligaments are overstretched, you want that fluid in there to hold and stabilize everything for a little while. And that's a whole other discussion, I guess, about injury rehab. So not necessarily do you want to go in, and there has been many, many times where I got called and said, hey, Christa, I was out to see this horse, and can you come and have a look at that? And I'll be like, well, when did it happen? And they're like, oh, like yesterday. I'm like, whoa. Let's talk about pain control first. Let's have, usually I get calls from a clients treating veterinarians. And I'd be like, you know what? No, this horse needs some rest. We need some pain medications. The vet just prescribed anti-inflammatories. I will see you. You're going to call me back in 3 days. So not necessarily do I treat every single area of swelling right away.
Okay, I love that. And I love that you brought up ice. I don't know if you want to go into that a little bit more, because ice is actually a little bit controversial, and there's some newer evidence that is saying that potentially it's not the best thing to use in the acute phase of injury. So is ice still something that you use and that you encourage people to use? And what, like, have you adjusted how you use it? Are you only using it at a certain point of that healing timeline? Let's chat a little bit about ice.
So I think each case is very individual. I think that I have a tendency to use cold as opposed to ice. So I would much rather put, say, for example, a wet towel in the freezer for a little bit so that it does get a little cold. With ice and horses and animals and stuff like that, is tricky because you can't get any verbal feedback. I think that's the main issue, is that you truly don't know. And there's several stages of when you apply ice, right? People can give you feedback through those 4 stages, right? It's going to go numb, and then it's going to, there's a whole other phase to that. Why, for me as a practitioner, that I would prefer to use cool or cold as opposed to ice, is because I can't get that feedback. You truly don't know what exactly is going on with the tissue and what the sensation is that the horses are feeling. I prefer to use cold, but I have 10,000 other clients that will always put them in a bucket of ice first.
Awesome, thank you. Guys, if there are any questions, please share them. Christa, you've touched on a few kind of contraindications and things you wouldn't do. And I'd love for you to expand on that a little bit. What are some contraindications that we need to be aware of when we're going to start looking at moving fluid in the body?
The one thing, obviously, has horse been seen by a veterinarian? Have they been assessed? Is it, a lot of people, they really want to start, going ahead and doing anything they can to help, but we need to find out exactly what's going on first, right? So the only time, and maybe I've mentioned this before, the only time I've ever had any negative reaction to kinesiology taping was with a horse that she had already been seen by the veterinarian. They called me out because the gaskin was really, really swollen. So I did my manual lymphatic drainage. She had no problem with that. As soon as I laid the tape on, she was violently kicking, violently. And I took it off as quickly as I can. And I said, we need to have the vet back. And so the vet came back, did another x-ray, and there was actually a spiral fracture in there. So, I think we always want to know, oh, he came in from the pasture, he's got a little bit of a swollen leg. What can we do for it? Always err on the side of caution. And then let's have some true diagnostics. Do they need an ultrasound? Are they fine the next day? Do we need an x-ray? Because horses, they hide a lot of stuff. And so I think, for contraindications, you need to be aware of what your limitations are as a horse owner, a trainer, rider, practitioner, veterinarian. There's been many times where I get phone calls and the vets are like, Christa, I don't know what's going on. Mostly that happens with systemic or really severe lymphedema cases. Have that knowledge and experience. And I think we all have to, and it's been vice versa, that I've been working with a lymphedema client and call the vet going, I saw this before. For example, I had a mare had chronic lymphedema. You actually probably see her a lot in my social medias, where she's a chestnut and she's got the blue lymphatic tape all on that hind leg. But when I started doing my lymphatic drainage therapy, she was draining up the leg, but out towards the hock. The hock joint itself, the edema just started pooling around it. I gotta find my camera, but was starting to pool around that hock. And I thought for sure that the edema was going to literally blow out of that area. I didn't know if it was an abscess in there. So anyway, I stopped treatment and I called the veterinarian and I said, hey, I would love for you to come out. I don't know. I think we need some pictures. We need some ultrasounds. I need to find out what's in that joint before I continue my treatment. And so what happened was he came and the joint was nothing else in there, thank goodness. And I continued my work and she's great now. So I think we all need to know our limitations and, you know, with contraindications, that could be an entire webinar on its own. That, you know, do they have a fever? Did they have an infection? You know, are they having any sort of like lung pathologies or had, oftentimes, you know, it's not just a one question kind of scenario. It's that you really need to go through and dig through case histories. And it's interesting because a lot of times, you know, people don't want to divulge that information, but you got to pull it, you know, ask everything and slowly. And one of the other things that I would love to say is have a look at the environment that they're living in. I don't know if that's a contraindication. It might be a contraindication to treatment if you can't control the environment that they're in. But that's also very important. I had one severe lymphatic case that she was completely systemic. The vets had, and a long story short, she had been having lung pathologies. And when with the heart lung connection, if one of them doesn't work, it does create that the heart's not able to pump the fluid out. It doesn't get rerouted to the kidneys, like whole gauntlet of stuff I won't get into. But what happened with her, I literally hadn't even been into the barn. I went to where she was turned out and she had a hay box. And I lifted up the hay. It was fresh hay on top. Everything was black mold underneath. Went into the barn. The whole barn was full of black mold. The water buckets, the walls, the stalls, the floors, everything was black mold. And I said, well, I can treat her, but this has to be addressed. And bless their hearts, they did a full-on scrub down. Yeah, they were amazing. Absolutely. You get busy and you don't see these things every day. You know, so would that be a contraindication to treat? A caution for sure. That's a caution because, you know, contraindications aren't necessarily absolute at 100%. Sometimes there's regional contraindications. Sometimes there's systemic. Sometimes there's local. Like, you know, contraindications, like I said, could be a whole other discussion. But hope that answers your question.
No, yeah, I love that, and I love that you spoke about the Hawk case, because I think that it's important for us to have the courage and the humility to also be wrong, right? And that's happened to me a few times as well, where I've had flags going up and I was like, we're getting the vet out. I'm not treating this horse until we've had diagnostics done. And then there's nothing. And then I'm like, well, okay, I was wrong, but at least I was wrong, right? It's okay. So I think it's really important to always trust yourself, err on the side of caution. If you feel like you need to, just get the vet out. Just do that referral and yeah, don't take any chances. It's not necessary. I think the last thing I would love to touch on, guys, if there are any questions, please send them now, because this is my last one. I'd love to talk about prevention. And again, I want to talk about this from the perspective of, for those of you that are listening, who are learning something right now, you're going to walk away from here and you're going to go create something and share it with your owners and with your clients, so that we can increase the awareness of lymphatic issues and how we can treat them, how we can prevent them. So in terms of prevention, what can we advise owners, say to owners, potentially in terms of the environment? You know, should they be moving more? Should they be, you know, can we do something in the stables to help encourage better, whatever? What would you say we can share with our owners as a preventative measure?
I think obviously movement is huge. Horses need to move. There are very few actual lymph nodes in the legs. And lymph nodes are like little kidneys. They filter all the fluid through the body, right? So before it actually gets to the main system, all these little lymph nodes, they have their own filtration system. And so because there's not a lot of nodes in the legs, the muscles actually have to kind of help pump all that fluid. And plus it also, goes into that cardiovascular system where it gets fluid moving too. So movement is invaluable if possible. Sometimes with severe cases, you have to wait. But in terms of prevention, movement is gold, right? We don't want that garbage can getting filled up. We've got to keep that fluid moving through those limbs and through that body. The environment, if you know that, it is, and it's been a really crazy mud season in Eastern Canada because we didn't get that huge, bitter, freezing cold for a long time that we normally have. So this year, our farms are experiencing a lot of mud. And so if you know that your horse is turned out 24/7 in mud, you really need to take precautions so that the skin doesn't become compromised, whether that's bringing them to a dry place, dry off their legs once a day, things like that, or try to manage that mud loss a lot better than normal. Prevention also, if you know that your horse has a reaction to vaccines, talk to your veterinarian to maybe split those vaccines up. That has been invaluable in many, many cases. We had a batch of vaccines, probably about 10 years ago now. And for whatever reason, I was on a huge rotation of 5,000 kilometers a month, driving to all these barns around different provinces and stuff. And it wasn't like horses only in this area reacted. It was this area, this area, this area. And what the veterinarians figured out was that it was the binder in the vaccine that caused this allergic reaction throughout the whole, Yeah, it was crazy. So what a lot of vets are doing now is that they're separating the vaccines instead of doing it all at once. So that may be an option that you have to talk to your practitioner about. But that's definitely a preventative thing, that that your horse is going to have a reaction and get swollen. Then maybe you break that up into 1 or 2 sessions instead of, or 2 or 3 sessions instead of all at once.
Okay, perfect. I love that. Thank you. So Dee, Wesley, thank you for joining us. It was great to have you. And Sally Harris would love to expand on our conversation about cold and asking, is cold water hosing too cold at the acute stage of trauma? I'd love to add, is it too warm? Because generally your hose is at kind of room temperature, right? So is it cold enough? Is it too cold?
No, I don't think it's too cold. Like you would, because your water's never going to hit close to 0 freezing, right? So I think water from a hose would be fine in acute stages. The only thing is that you'd have to worry about the pain level of the horse at the time. And no matter what, you're going to always think about that anyway. But even in like Canada, we're not all of us necessarily have an indoor arena to work with. And so, you can use a cold hose and stuff like that. But I don't think with ice, that it's at 0, and less. So the temperature, obviously to keep that ice frozen has to be below 0. Whereas cold water wouldn't even, probably would even be 5 degrees Celsius or something. I don't know that in Florida we have a problem because when I worked on the circuit down here for all those years, is that the water doesn't get cold enough because it's just Florida. It's 35 degrees, most days, and so it never gets cold. That's always a little bit of a different issue, right?
No, it's a nice, warm bath to go underneath the tap.
Yeah, exactly. Yeah.
Awesome. Okay, awesome. Guys, thank you so much for joining us live. It's been so amazing. Christa, thank you. You've been amazing. As always, just sharing your knowledge, chatting about this subject that we don't speak about enough. I want to share 2 things with you guys before we leave from our side, from Online Pet Health side. The first is that next month, on the 15th of April, is International Vet Rehabbers Day, and it is the day where we celebrate us. So we are going to be kind of encouraging and organizing a few very small, like just gatherings, because we're always seeing each other online and we're so rarely seeing each other in person. So here in South Africa, we've got one in Cape Town, and we're going to have one up in Joburg. And wherever you are in the world, I want to encourage you to take it on yourself and just organize a little get together on the 15th of April, a day to celebrate, a day to get together with your colleagues, a day to just be proud of who you are and what we achieve. So that's what we're doing on the 15th of April. Add it to your calendar, do it, get together. You haven't seen your friends in a while. It's time. So that's the first thing. The second thing is that our Vet Rehab Summit, we have moved the date and we have confirmed our lecturers and our theme for the year. So the date is now on the 10th and the 11th of November, so it will be a 2-day event. It's going to be live again. So guys, this is really, really important. Basically, everything we do is recorded and everything we do is convenient and easy, and you do it at your own time, except the Vet Rehab Summit, because it is so important for us to sit in front of each other and talk about these things and engage live. So the 10th and the 11th of November, we're going to be doing the reveal of the theme and our lecturers very, very soon. But I know you're going to be as excited as I am. I've been trying for this one for like 2 years, and I finally made it happen. So yes, celebrate. Okay, and those are the things for me in your diaries, the 15th of April, 10th and 11th of November. Christa, thank you so much for joining us today. Everyone who's joined us live, thank you. If you've watched the recording, please feel free to ask your questions, share, discuss. That's what we're here for, and we'll check back in on the recording over the next few days to answer any new questions. All right, thanks, guys.
Thanks, everyone. Take care.